Over the years, official guidelines for cholesterol have constantly changed. While some experts now believe that high cholesterol isn't a problem, the official target levels have become lower and lower, resulting in a situation where 25% of the adult population are prescribed medication to reduce cholesterol. But are these drugs safe? Do we really need them? And are we getting a fair chance to make informed decisions about the risk versus the benefits? We'll discuss all this in today's video, as well as specific foods to eat more of in order to protect yourself and more. Okay, let's start with one of the oldest cholesterol medications, bile acid resins. Bile acid resins like cholestyramine, cholesyvalum, and cholestyramine are widely considered some of the so-called safest cholesterol drugs. However, they have a dark secret. While these drugs don't cause the immediate side effects of many others, over the long term they can cause severe vitamin deficiencies. These drugs work by binding bile acids in the intestine, the stuff that breaks down food. Normally, this acid is reabsorbed by the body and recycled. That's where BAR drugs step in, preventing the reabsorption of these acids and forcing the body to use more cholesterol to make new bile acids. Thus, cholesterol levels go down. It's a clever mechanism, similar to another intestine-focused drug we'll discuss later. But, of course, there's a catch. The problem is, bile acid resins also bind to fat-soluble vitamins like vitamin A, vitamin D, vitamin E, and vitamin K. These vitamins are crucial for blood clotting, maintaining strong bones, protecting arteries, and keeping your heart strong, as well as immunity, vision, and skin health. Sounds kind of important, huh? That's because it is. If you've watched any of our other videos, you'll know that these 4 vitamins come up time and time again, with a plethora of research showing deficiencies are strongly correlated with many diseases. So the sad irony is, people are told to take these medications in order to protect their heart, but the very same medication slowly causes vitamin deficiency, actually making them more vulnerable to disease. So if you're taking bile acid resins, make sure you're eating plenty of vitamin-rich fruits and vegetables. Get your blood tested for vitamin deficiencies, and talk to your doctor about whether you really need to be taking this medication. Next, fibrates are a class of medication primarily used to manage high triglyceride levels. They're often used alongside statins, which we'll get to in a moment. Fibrates are known to cause particularly concerning psychiatric effects, including depression, severe irritability, and aggression. These effects are linked to how fibrates influence brain chemistry. Fibrates affect the structure of cell membranes, the outer coverings that protect brain cells. Brain cell membranes are like hard hats, with cholesterol acting as the foam lining, essential for both protecting against impacts and maintaining flexibility. When this cholesterol is reduced, brain function is impaired. Neurons can't communicate as they normally would, leading to disruptions in mood. What's more, fibrates are associated with an increased risk of venous thrombosis. Venous thrombosis is when blood clots form in a vein. Typically, this happens in the legs, known as deep vein thrombosis. If the blood clot breaks loose, it can travel through the veins to the lungs, causing pulmonary embolism, blocking blood flow, and potentially causing sudden death. Although venous thrombosis is relatively rare, these side effects are worth careful consideration in your risk-benefit analysis. Of course, you should never stop taking your medication without guidance from a trusted healthcare provider, but rather use this information to guide your conversations and know when to ask for a second opinion. At number 2, we have ezetimibe. Ezetimibe inhibits your body's ability to absorb cholesterol in the intestines. Ezetimibe targets the protein NPC1L1, which is responsible for transporting cholesterol into your gut cells. By blocking this protein, ezetimibe effectively limits the amount of cholesterol that makes its way into your bloodstream. It's often prescribed along statins, but also on its own. Now, researchers estimate about a quarter of the adult population have some levels of fatty liver disease, with that number increasing if you have heart disease or diabetes. And unfortunately, ezetimibe can exacerbate liver disease. That's largely because even moderate liver impairment can lead to too much ezetimibe building up in your system, as well as potentially increased risk for hepatitis and autoimmune disease. Furthermore, ezetimibe doesn't play well with other medications. Combining ezetimibe with fibrates, for example, can increase the risk of gallstones, a painful experience that you definitely want to avoid. Likewise, it can also interact with bile acid resins, immunosuppressants, warfarin, and antivirals. And as we discussed, it's sometimes prescribed alongside statins. However, this combination can intensify the side effects that come with statins, which we'll get to in a moment. All too often, people get stuck in the cycle of polypharmacy, where managing the side effects of one medication can lead to additional drugs and additional side effects, and on the medication list grows. Ezetimibe can be especially problematic here. Ultimately, the goal should be minimizing the number of medications you take, done safely and in conjunction with a healthcare professional who knows your situation. That's why informing yourself, asking questions of your doctor, pursuing answers and getting second opinions when needed is so vitally important. After all, these are incredibly strong chemicals to put in your body, day after day. It's also important to note at this stage that if you are taking ezetimibe, or any drug for that matter, it's vital to read the information leaflet and follow the instructions exactly. For example, ezetimibe needs to be taken 2 hours before certain other medications. That's because of serious potential interactions, and because they can reduce the effectiveness of one another. Likewise, other medications need to be taken with food or on an empty stomach, or splitting doses between morning and night. Read the fine print, make sure everything seems in order, and follow the instructions. While cholesterol medications may be arguably overused and overprescribed, incorrectly taking them can be even worse. Next, one of the most widely prescribed medications in the world, statins. Despite their prevalence, a growing body of research is revealing some very concerning potential dangers of statins. To explain concisely, here's cardiologist Dr. Stephen Sinatra from the Heart Disease Code documentary. In a moment, we'll discuss a few important CoQ10 foods to eat plenty of if you're taking a statin, to at least mitigate some of the risk. But first, let's talk about statin-induced myopathy that Dr. Sinatra mentioned. Statin-induced myopathy can make life very uncomfortable. In the most basic version, this means muscle pain and weakness, extreme fatigue, and an inability to focus. If it gets more severe, it can lead to rhabdomyolysis, where muscle tissues break down and die. This can lead to kidney damage and a downward spiral of illness. Not good. Statins can also increase the risk of cataracts. The lens of your eye needs cholesterol in order to stay clear, but statins artificially reduce the available cholesterol. In fact, a 2013 study of 46,000 people found that statin users had up to 27% higher risk of developing cataracts compared to non-users. So if you're on a statin, make sure to get your eyes checked regularly. Statins can also cause hyperinsulinemia, or too much insulin in the blood. Insulin is the key that lets glucose into your cells from the bloodstream. When cells become resistant to insulin, your pancreas cranks out more and more to try get them to respond. Well, a wealth of evidence shows that statins can cause cells to become insulin resistant, leading to hyperinsulinemia, even in people with previously normal blood sugar. Following this natural progression, in 2013, a study was published with the remarkable title, "Do Statins Cause Diabetes?" Researchers found that yes, statins do cause diabetes. Particularly at risk are older people, especially women, as well as Asians due to genetic differences. And with insulin resistance comes high blood sugar, or hyperglycemia. Once you've got consistently high blood sugar, that opens the door to a whole host of problems, like nerve damage, kidney damage, blindness, and, ironically, cardiovascular disease. The very thing statins are meant to prevent. In fact, the United States Center for Disease Control publishes the information freely on their website, stating that some research has found that using statins increases blood sugar because statin use can stop the body's insulin from doing its job properly. This can put people who use statins at higher risk of developing type 2 diabetes. The officials state the information on their website, yet statins are still the go-to drug. How crazy! As if that wasn't bad enough, statins have been shown to interfere with the production of testosterone. Cholesterol is needed to make testosterone and other hormones. So when a drug reduces cholesterol, it also reduces hormone production. Studies have found 7 to 10% reductions in testosterone in men taking statins, with accompanying declines in sex drive, energy, muscle mass, and more. We discussed vitamin K earlier. And you guessed it, statins also interfere with vitamin K. Vitamin K2 is particularly important for heart health. It guides calcium into your bones and prevents it from building up in your arteries. But by blocking vitamin K2, statins allow calcium to build up in arteries, accelerating heart disease. Again, the opposite of what we want. And finally, statins deplete levels of CoQ10, the essential nutrient for energy production in every cell. CoQ10 depletion decreases the number of mitochondria and impairs heart function. One study found that 71% of healthy people developed asymptomatic heart dysfunction after taking statins for 3 to 6 months. But the dysfunctions went away with CoQ10 supplementation. So what can you do to protect yourself if you're on a statin? First, have an honest discussion with your doctor about whether you truly need to be on it given your individual risk factors. If you do stay on it, make sure to include dietary sources of the nutrients it depletes, like aged cheeses, natto, and egg yolks for vitamin K2, and consider taking CoQ10 and vitamin K2 supplements, while monitoring your levels to maintain healthy ranges. The research is clear, statins come with serious risks that shouldn't be brushed aside. Furthermore, research is increasingly showing that high cholesterol isn't necessarily a problem. Rather, it's the quality of cholesterol that actually matters. Either way, the goal should always be to reduce medication dependence, with guidance from your healthcare provider, because all medications are going to have side effects. To give yourself the best shot at healthy cholesterol, you might like to watch our video on the top 10 vegetables for lowering high cholesterol. We'll leave a link to that in the description, or click the image on screen.